From the moment I became a dentist, I was obsessed with becoming the best cosmetic dentist I could be. Fast forward years later, and I've developed these skills that have allowed me to provide smile makeovers that have won awards, smile makeovers on celebrities, professional athletes, and even fellow dentists. If you're serious about mastering clinical dentistry, then this video is for you. So I've always had an obsessive personality, even when I was a kid. At the time, I didn't really think of it, but looking back, I definitely did. Even just playing like Xbox, if I decided that I wanted to be good at a game, I would be obsessed with it and I would be sick at that game. And then it got into my A-levels as well. I decided that I wanted to do amazing at my A-levels and I wanted to get into dental school. And I got the grades to get into dental school, despite me not having a track record of doing well in any exams before that. And then that has gone into my dental career as well. When I became a dentist and I got exposed to cosmetic dentistry, before that I wasn't really into dentistry, but when I got exposed to cosmetic dentistry in my VT year, I decided that I wanted to become the best cosmetic dentist I could be. And then I was obsessed with it. I tried to go on all the courses, I tried to develop all the skills. And clinical dentistry is only one part of becoming a good dentist. There's loads of different parts. You've got teamwork, you've got communication and different avenues that you need to master to become an overall amazing dentist. But clinical dentistry is so important. Being good with your hands and providing that actual dentistry is a massive part of it. And these 8 skills are the skills that I've thought of that would help you as a young dentist become better at providing cosmetic dentistry, providing better smiles for your patients. So without further ado, let's go through the first one. The first one is hand-eye coordination. It's a kind of generic term, but it's basically your ability to look at things with your eyes, and this is probably the most important part of it. People think to be good at dentistry you need good hands. Actually, you probably need good eyes, and that's more important. But hand-eye coordination is having good eyes, but then being able to control the fine motor muscles in your hands to be able to move whatever it is, a drill, instrument, and do exactly what you want it to do. And this is not something that you're born with. It's not something that some people have or other people don't have. It's something that you can develop. And obviously the more you do, the more dentistry you do, the better you'll get at it. But there are dentists out there who I imagine have done dentistry for 20 years and their hand-eye coordination levels is still stagnant. You have to consciously try to get better at it. You have to carry out that deliberate practice. And you have to be aware of your hand-eye coordination as you're practicing on patients or if you're practicing on models. And as you do that, you start developing little tricks that allow you to be able to control your hands and use your eyes a lot better, and it's really, really important. Number 2 is understanding tooth anatomy. I mean, as a cosmetic dentist, your job is to basically make teeth look like teeth. That is what your job is, and the amount of dentists or cosmetic dentists who don't even know what a tooth's meant to look like and then they expect to be good at cosmetic dentistry is laughable. I mean, it is your job to know what a tooth looks like. And you have to be able to not just know it, you have to understand it fully. And there's loads of different textbooks out there. Maybe I'll link to some in the description if I know how to do that. But there's loads of different textbooks out there that teach you tooth anatomy. And don't just read these textbooks once. I've read these textbooks 5, 6, 7, 8, 10 times almost to try and deeply understand, so that now when I look at a tooth, you know when you look at a tooth in a patient's mouth that you've created and it just doesn't look like a tooth and you just don't know why it doesn't look like a tooth. It's because you don't know what an actual tooth looks like. Me, when I look at a tooth, because I know what teeth look like and I've researched it and I've spent a lot of time understanding it, I know instantly why that tooth just doesn't look like a tooth. There's something wrong with it. So that is another skill that I would make sure that you prioritize if you're a young dentist looking to get into cosmetic dentistry and increase your private list. Number 3 is smile design. And this is how your teeth relate to one another, how your patient's teeth relate to their lips, how they relate to their face. So it's not just tooth anatomy that you need to understand. You need to understand how the teeth relate to one another, the proportionality. And again, you're a cosmetic dentist. Your job is to make teeth look like teeth. Your job is to make smiles. So you need to know what an ideal smile looks like in the different variations so that you can actually have a vision to create that smile in your patient. The 4th skill, which I was thinking about, is focus. So this is not something as tangible as tooth anatomy. It's not something that you can read a textbook on, but it's very important. Most cosmetic dental procedures and smile makeovers do take a lot of time. if you're doing it properly anyways, it does take a lot of time. Some of my procedures can take up to 8 hours, and it's very difficult to be effective at it if you don't have the skill of focus. And especially in this day and age with TikTok and social media and all of these things, everyone just has ADHD brain, and some people can't even read a single page in a book. And I'm sure there's a lot of you dentists are unable to even do that. But if you can't do that, then how are you expected to sit there behind a patient and focus for several hours and make the smile or do whatever you need to do? I used to be like that. I used to be terrible at focus, and I used to always go on my phone and do stupid stuff that would break my focus. But now, because I'm aware of the importance of it, I'm able to sit there, whether it is behind a patient or on a computer, I'm able to sit there for many hours and not be distracted. And that's all focus is. It's basically not being distracted. And some things can help, like not having your phone anywhere near you. That is basically the main thing for me. If I'm sitting there in a room working, or if I'm in a surgery, I'll just not have my phone there. If my phone's there, I'm gonna go on it, and I don't have the discipline to not go on it if it's there. But just simply putting your phone in another room will help. But you have to develop the skill of focus, and you won't be able to get to a point where you're focusing for 4 hours straight up off the cuff if you can't focus for 2 minutes. But it takes time, and the more you do, the longer you'll be able to do it for. And it's super important if you want to become a good cosmetic dentist and carry out smile makeover cases that take several hours to carry out. Number 5 is an in-depth understanding of the two main materials that we use as cosmetic dentists. That, of course, is composite and porcelain. And you've only got 2 materials, so you should know every single thing about these materials. There's no real excuse. You should know all the different types of composites, all the different types of porcelains, how to treat them, when to use which one in what case. And yeah, there's nothing really else to say about this one. It's just do the research, get used to using them, get used to knowing when to use them and why you use one over the other in certain situations. But just get really good at using these materials. Number 6 is occlusions. Not the most fun topics, and I certainly don't enjoy learning about it, but there's no getting around it. It's very important. If you want to be known as a good cosmetic dentist, then not only do you have to get your work to look good, but you have to get it to last. And one of the ways that your work won't last is through mechanical forces of your patient biting. So you have to be able to put work in your patient's mouth, whether it's porcelain or composite, in a way that is conducive to long-lasting results. You have to understand static occlusion, dynamic occlusion, and you have to be able to, like I said, put your work in that environment so that the forces are balanced and that the work's gonna last a long time too. Number 7 is lab communication. Particularly important if you're doing porcelain, because of course the lab technician is gonna make the porcelain. You have to be able to develop a relationship with a good technician. You have to be able to trust one another. They have to know your aesthetic. You have to know what they require to provide your aesthetic. And even if you're doing a lot of composite like I do a lot of smile design, which does involve lab technicians, and you have to be able to communicate your vision for the smile to the lab technician. And yeah, I think being able to communicate with someone to help you make these smiles is very, very important if you want a long-lasting, thriving cosmetic dentist. And the last skill is not really a skill, it's more of a belief, and that is a desire to get better. And this is for not just cosmetic dentistry, this is for any skill that you want to get good at. If you want to get good at a skill that is quite hard, which most skills that are worth getting are hard, then there's going to be times where you're going to want to give up. There's going to be times where you're going to struggle. There's going to be times where you fail, a lot of failure. You're going to feel embarrassed a lot of the times. But if you have that desire to become good and get better, then that will force you through these difficult moments and allow you to get better, because you do learn from every bit of failure. And I've failed so much within cosmetic dentistry. You might see a lot of my cases now and you might see how good they look or whatever you might see, but trust me, I've been through a lot of failure, a lot of patients not being happy, and you just have to go through it. If you continue to kind of progress, if you don't let that get to you, if you try and learn from every single case and you have that desire to get better, then it's inevitable. And if you just be patient as well, it's only a matter of time before you're going to be able to get good at that skill. And the same thing applies with cosmetic dentistry. Have the desire to get better, learn from your failures, learn from your successes, and in a matter of time, it might take years, but if you really want it, then years is nothing. Because when you have it, then you'll be a good cosmetic dentist, you'll have a thriving career, you'll be able to do the work that you want to do, and obviously you'll be able to earn a lot more money alongside it too. So these are 8 skills that I found are crucial for me to become a half-decent cosmetic dentist. There are probably many more, and maybe I'll make a video part 2, but if you've got some value from it, then I would appreciate you sharing it to any of your colleagues, any of your university friends. Like the video, subscribe, all of that jazz, and I'll see you on the next one.